Hi, everyone, and welcome back to the hashtag #CArthritis event, which is something that Arthritis Consumer Experts hosts. We do that with the great encouragement and support of the Canadian Rheumatology Association and the Arthritis Health Professions Association at their annual scientific meeting. And it gives me incredible, my name's Cheryl Koehn, by the way. I work with ACE. And this is streaming to you through Arthritis Broadcast Network, the news aggregator site run by Arthritis Consumer Experts. Okay, so that's the who, what, why, where, when. And I'm so thrilled to be here today in studio with Julie Herrington. Julie, welcome once again into the studio. We can't wait to hear about the two posters that you presented.
Thank you. Thank you so much for having me. I'm excited to talk to you
Yay!
today, Cheryl. Yeah,
Yay! We're knowledge disseminating right now.
perfect.
So before we dive in, Julie, I want to tell the audience a little bit about you.
Sure.
So Julie is an advanced physiotherapist practitioner with ACPAC training, working with the pediatric and young adult rheumatology teams at McMaster Children's Hospital in Hamilton, Ontario. The first thing I think of, Julie, is it's a pity that we're having to do physiotherapy for children with arthritis, right?
Yeah, you're right. And I guess I always kind of forget about that because I'm so immersed in the world anyway.
Yeah. But to
But I
just to
guess,
get it's just to get the public's head around the fact that children get arthritis and require, really skilled hands and knowledge such as yours. Okay, that was just a little interlude.
no problem.
Julie's been the ACPAC Special Interest Group chair for the past 2 years and has been strongly advocating for the role of ACPAC clinicians to fill gaps in our healthcare system. And I can tell you this is brilliant. So excited about your work. As an advanced practice clinician, she emphasized the importance of contributing in all the pillars, including education, research, and leadership. She's finished 3 studies looking at the impact of this ACPAC role in pediatric rheumatology, so rheumatology for kids in shorthand, creating support to help implement this role in every Canadian pediatric rheumatology center. So, just a little bit of this, a little bit of that in all your spare time.
Thankful.
Yeah, it's an amazing body of work, Julie, and we're so excited to have you here, as I mentioned at the start. So did I miss anything? Anything else you want to say about yourself and what you do in your day-to-day work?
No, I think that sums it up well.
Okay.
And every one of those sentences, I could probably go off on a tangent, but let's stay focused.
Yeah,
And
you and I,
what
we
I'm
got to
here to
hold
do
each other to
today. Yeah.
task here. Okay, well, let's just dive right in then. I mentioned during your intro that you have presented 2 posters at this year's annual scientific meeting. And let's talk about the first one. And I'm going to read out the very long, complicated title, but you're going to make it lay-friendly and easy for our viewers to understand. And you're going to give us kind of the Coles notes of each of these 2 posters. So the first one is an advanced physiotherapist practitioner's level of safety performing juvenile idiopathic arthritis care, or I love this, Applejack, comparing key performance indicators with the, I guess it's pre-COIN,
PR-COIN.
PR-COIN Registry. Okay, so break that all down for us. So here we
Okay,
go.
yeah, it's a long title, but hopefully we can make it pretty simple.
Okay.
So, I'm a physiotherapist and I'm in this really wonderful role, an advanced physiotherapist practitioner, which essentially means I went back and did this ACPAC program training, which is at the University of Toronto, Faculty of Medicine. It trains physios, occupational therapists, nurses, and chiropractors to work in an advanced practice role. And for any of the patients listening, if you've worked with someone before, you will have a clear sense of exactly what gap we're filling in the healthcare system. And if you haven't, hopefully you'll know a little bit more after I explain this. At our center, when we get kids referred from any source to find out whether or not they have a rheumatic disease, they go through a triage process, which would be the same on the adult side. And we have different categories. So we have our systemic kids where we have to figure out, do they have lupus? Do they have fever syndromes? Those cases never come to me because my background's physiotherapy, so musculoskeletal type issues. Um, then there are the kids that are coming specifically to find out whether or not they have juvenile idiopathic arthritis. I get put into the mix with the pediatric rheumatologist to determine whether or not these kids might have a rheumatic disease. So adding this role in allows us to kind of expand access to care, expand the healthcare team that might see these kids and families on their very first visit. If someone gets assigned to me, then I'm going to go through the appointment exactly the same way that the rheumatologist would. So do all my homework ahead of time, pull in the labs, the imaging, any other notes that would come to us, ask all the questions, do the examination, and get to the end of, do they or don't they have a rheumatic disease? And I've been doing this now for about 5 years. One of the very first studies I did, which was not the one that I'm going to share in a moment, but the very first one I did was to find out who are the kids that I actually would see on the first visit. And when we looked at over 100 of my very first consults, it turned out about 80% were not diagnosed with a rheumatic disease.
Wow.
And that was a whole other study, like who were these kids? And turned out most of them, what they needed was physio, which is kind of interesting because it makes this role, almost perfectly fit because I could then help those kids
And you
kind
could
of
go on to
get on
deliver
their legs.
physiotherapy. Yeah.
Exactly, get them going. But then about 20% of the kids were diagnosed with a rheumatic disease, mostly juvenile arthritis, juvenile idiopathic arthritis. And there's a couple of other conditions as well that would kind of fall under my purview. So we started to look at, okay, if these kids, I see them on the first visit, they're diagnosed, and then they stay on my schedule. So now this family, I'm the face that becomes kind of their case manager,
Right.
their primary contact. And similar to adults, we have a standard follow-up time, which is approximately every 3 months or varies depending on what's happening. And and the care would go on. And so we had this question, especially, if a family came in and said, like, well, where's the doctor? Or
Right.
like, am I going to get the same kind of care with you compared to if I'm always just working with the doctor? And so that's where this study has come in. We wanted to look at, okay, these kids that I'm going to follow long term, what's the safety component? Is anything going to get missed? Are all the things that are supposed to get done, are they all going to get done and then flagged if there's a problem? So safety, then we just wanted to look at what's the quality of care and what are the outcomes? Do these kids do as well as any other child that's going to be followed in regular care? And that was the basis for this project. So we took a 2-year period of these kids, and each time they came, we counted this as one visit. We had about 130-ish visits that we were able to look at. We decided to compare these visits with what was happening at our own center with the other rheumatologists that work at McMaster, as well as compared to the entire PR-COIN Registry, which is a North American registry that collects basically quality indicators, the safety indicators, and outcomes of kids that have juvenile arthritis and just tracks it over time. So you can start to see trends and help other people improve, their own quality of care. So the PR-COIN registry in that period, we could compare it to 12,000 visits. So I had just
Wow.
about 130. They had about 12,000. At our own center, we had about 200 visits that were in the registry and that we could actually do the proper comparison to. So we looked at these quality indicators, and this is like, I'm sure, Cheryl, when you have gone yourself, like they probably do a joint count. They
Yep.
should you like, what's your pain level? There should be a quality of life questionnaire. I don't know if they always do that on the
Yeah,
adult side. There should be a functional questionnaire. And these are all the exact same things for kids. And so it was really, were these things asked? Were they recorded at all the visits? And we considered those to be the quality indicators. And when we compared, they were definitely comparable to the same site, and in many cases, better than the whole PR-COIN registry as a whole. I know, thank goodness for that. And it's probably because it's a new rule, so I'm very much following the rules
yeah,
and certainly want to be delivering the best possible care that
yeah,
I know how to. And and then besides that, there's also safety things. So again, if anyone's on certain medications, like you have to do your blood work on a regular basis. And with kids, they have to have their eyes checked on a regular basis. If you start a certain medication, you have to have TB screening. And then we have standards for how often people should be checked, and that's kind of in the safety realm. And again, it was the same thing that it was completely comparable to our own center's care, the rheumatologists, as well as comparable to the PR-COIN registry, which was very reassuring and felt like the numbers are high enough to say to a family with confidence, you know what, you are going to receive very similar level of care,
yeah. I
essentially.
think that's the important aspect of the larger registry that you're referring
Yes,
to. You
yes,
do your own study work, but then you kind of go, but how are we doing in comparison to these big,
totally.
much larger numbers of patients? And it gives you then, I imagine, Julie, the ability to sit with parents and with huge confidence say, here's how this is working. Here is how this model of care is working compared to, and
The North American
as a
registry.
parent, you must just be so elated with this news.
Well, I always hope so, and that
Yeah.
will actually lead into the second study.
Okay.
But yeah, I hope so, and I think even without having done the study, I would have felt that, to be able to
But
communicate
the
with
proof is
parents.
in the pudding, isn't it?
Yeah.
Yeah.
And
Yeah.
that's why we decided to do it for that exact reason.
Yeah.
Certainly it's for the family's perspective, and then it helps even going into the pediatric rheumatology healthcare community to let other teams across Canada know about the program, about the role. Could this help at your center? Could
Right.
it offshoot some of the stresses that healthcare teams feel? So there's lots of motivations for it.
Yeah.
Certainly it's the family would be number one.
Yeah, that's amazing. I think as an adult who has rheumatoid arthritis, and I imagine it's not that different for a parent who has a child with some sort of autoimmune type of arthritis. The first thing we ask ourselves when we're given a prescription and we're told to do something is, well, are you doing this on other patients and how are they doing? Well, this is the way that you know that what you're telling them is dead on, is really fact.
Yeah,
This is the type of research that proves it, so to speak. So,
exactly.
massive congratulations. Okay, now that we're all teased with study one, tell us about this second poster, the GAPS study, gender and advanced physiotherapy practitioner satisfaction in pediatric rheumatology.
Yeah,
So, okay, go from there.
for sure.
So,
Thank you.
what did this
Thank you for
study
asking.
aim to do?
Sure. So this was kind of the third of these three studies we looked at, just who am I seeing? Is it safe? And then what do families think? That's
Right.
what the study was all
Okay.
about. Probably the most important, to be honest, but took a little bit of time to set a base to get to this point. So we did this prospectively. We started in May last year and ran this for 6 months. And essentially, any person that was seen in the APP shared care model was approached and asked if they would like to answer basically a satisfaction questionnaire.
Yeah.
The satisfaction questionnaire had been used before with other APP, that's Advanced Physiotherapist
Right.
Practitioner models across Canada, mostly in adult settings though. So we used something that had been used before, asked parents and we asked the kids too. So 12 to 17-year-olds were able to also respond to this. It was pretty simple, like 9 questions, open-ended responses if they wanted to add other comments, just to find out, like, what do you think about this? Like, was it what you thought it was going to be? Were you satisfied? Did you get the answers that you wanted? And onwards. And what we found by the end, and this was new consults, so people that might have only come even one time and found out they didn't have a rheumatic disease, and also to families that I was
Okay.
following long term.
Okay.
And again, the results, the satisfaction was very high, which is very reassuring. And it was very comparable to other studies where we have seen this model of care. And I think for me, what I got the most out of this and want to share back to families in particular is when people took the time to make little comments in the open-ended boxes, not just give a number for, where their satisfaction was, but the themes that came back over and over again from both the parents and the kids was that their appointment was very thorough, that they felt that the person they were speaking to had great knowledge, that they were caring, that they felt there was value for them to have traveled, to take time off work, to spend, like our appointments are long, so it could
Yeah.
be an hour, even sometimes 2 hours long. They received, conservative management pointers more so than just saying it's not rheumatic, now go do this. There was actually some tips given that they could then go and start with. And so on the poster, this has included these themes and these key things, but they really are not that unique to me. And this is a study of just one person. When you look at the literature for anyone who has gone through the ACPAC program, who is working in these APP roles, it is the same. The appointments are thorough.
So
The
whether it's in the adult setting or in
Yes.
the PD, okay, I get it.
Yeah, and you see this repeatedly. It's almost, I've started to reflect after having done this study that if a family were to ask me, like, what should I expect when I'm going to go see, oh, I got this appointment, it's going to be with an advanced physiotherapist practitioner. I have no idea what to expect. I don't even know if I'm going to see the doctor. I would love one day for this will be a very thorough, caring, respectful appointment where you will feel there was value to have shown up for this appointment. And you probably will leave with some other tips beyond just the medical component. Because again, like there's enough literature out there that this was not unique to this one particular study.
You
And I
know,
really think it describes this level of where we're filling this hole maybe in the system.
yeah, well, first, huge congratulations, Julie. These, I know there was the original study, which was, looking at who,
Yes,
and these two others were about, safety,
exactly.
and thirdly about satisfaction. And when I think about what you've just shared about these open-ended comments, as you
Mhm.
know, we run our own national survey program and
I
we
know.
make that opportunity for open-ended comments happen frequently throughout the surveys because for us, we're by, for, and with people with arthritis disease, that qualitative comment is so powerful. And it sometimes turns the light on and fleshes out what are just hard numbers and gives it context and gives data a human
Yes.
touch, if
Well
you will.
said.
I don't know if I'm phrasing this quite right, but
I would
what
agree.
you've just described is the care in healthcare.
Well said. I might
It,
use that.
but by
But
all means,
yes.
go for it. It is about caring to improve one's health. It's not just about the measuring part.
Right.
Um,
It's
yeah,
and that's so well said. And many days I wake up and I'm so incredibly grateful that I'm doing this job and I'm filling this role, and and I get there and I think, oh gosh, yeah, these, whatever family's in front of me, they just want the information. They
Right.
just want to know. And they want, no, not everybody wants tons of detail, but hopefully, we can read it to how much do you want? What do you need? What have you not been able to get up until this point? And how can we put you on your way? I really, really live it. And I think it's part of who I was as a physio, just practicing regular physio
Yeah.
anyway.
Yeah.
And maybe that's what we bring. I'm not exactly sure, but again, to know that this was not a unique finding, it does make me wonder if we're just trained that way. We came up a little bit different
Well,
than than
we're gonna bottle it up and put it out on the marketplace for free. I just feel like every physiotherapist, because of the prevalence and incidence of not just arthritis as a whole, but also juvenile arthritis, it's not it's not rare, but nor is it common. It kind of straddles sort of somewhere in between.
yeah.
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 Listen, when you think about this work, the two studies in particular that you presented at this year's meeting and the first study that got all this rolling, um, how has that moved the work forward? The
Mm,
meeting's theme, as you well know, ascending to new heights,
mhm.
peaks of innovation in rheumatology. To me,
For sure.
ACPAC trained therapists, that is innovative in a huge way. And I know the work that the Arthritis Health Professions Association is doing up in northern communities, for example, in Ontario, and how ACPAC trained
Mhm.
therapists are playing a very important role there in adult settings.
Yeah.
How do we literally bottle this and get it out there across the country?
Yeah. Thanks for asking that question.
Seriously, give it to us. Give it
Well,
to us.
it's such an interesting thing. So again, being in this role, of course, the majority of the work is in this clinical new level of the healthcare system. But part of the responsibilities also need to be in leadership, in
Right.
research, and in advocacy. And my advocacy muscles are growing. I
Yay.
would say. And I think actually, Cheryl, you helped our whole organization out as I was starting as the chair of the ACPAC Special Interest Group, which is
Yeah,
basically representing the grads of the ACPAC program.
right.
Um, and when you ask about innovation, and I kind of almost put that with advocacy a little bit in this context anyway, I do think it would be wonderful to have this role in every pediatric rheumatology center across Canada. I'll put it up there as the super lofty goal. I attended the Capri Network meeting on Tuesday before CRA. So that stands for the Canadian Alliance of Pediatric Rheumatology Investigators. And it's this wonderful group who I've just joined as of last year as a non-physician partner. There aren't too many of us, but and it's basically people who are interested in pushing forward research initiatives
Yeah,
across Canada.
yeah.
But all the division, all the people were there at this meeting, and I presented this and I said to them, what do you think? Could we get this role across Canada? And I think there's great interest because there's workforce concerns with pediatric rheumatology. There's geographical issues for all of the centers trying to deal with, I know you're in BC, so I know like northern BC, they've got their issues as
Yeah.
well as in Ontario. Every center is
Any place that is rural remote has
yeah.
challenges. Yeah,
Yeah, exactly. And this role could really fit there. So I think, people look at it and think, okay, this might be interesting. And how would this work? So one of the first barriers would just be that the centers and the teams are like, okay, the door gets opened. The second issue is, of course, the healthcare systems.
right.
So it's provincially, every province has their own nuances. And as a physio, I have a college that's an Ontario college. So they're different across the country, with different regulations. So there will be some barriers. There's no doubt about it. I guess, I do have passion for this. And at the end of the day, I see major bonus for the families. Like you're right, I have this data now to actually say that there is benefit and impact. I see positive impacts for the current teams, like the rheumatologists, who are really wonderful people trying to do everything. And building a team certainly could help alleviate maybe some of those pressures. And then, like, I'm a mature physio, so this kind of exciting, passionate work is rejuvenated me. I'm
Yeah.
ready to go for another 10 years. Whereas if I, didn't have this new pathway, I don't know where I'd be exactly right now. So it's a way to keep people that already have rheumatology knowledge in this field too. So there's
Retain them and give
Mhm,
them new challenges. And I think the
exactly.
thing that also keeps people in their profession is when they see the work that they do really having great meaning in the lives of families. It's,
I would agree with you completely that it
yeah.
does feel very impactful. Yeah, like I said before, I'm grateful for the work, and I come home and I think, wow, like that was a pretty good day today. Like I did some things.
Man, the
I
families who
made some
have
things.
you in their corner are
Yeah.
very, very lucky, as I know they are with all ACPAC trained therapists. Julie, in our remaining minute or two here, I first of all, just want to thank you for sharing all of this great knowledge. And you always have us in your corner. When I say us, arthritis consumer experts, I think I've already cooked up an advocacy scheme to get this all across the country, so we'll have to follow up after this
Okay, great.
session.
Sounds good.
Yeah. Um, and if members of our audience, if you want to learn more about the role of an ACPAC trained therapist, you can certainly reach out to Arthritis Consumer Experts, and we'll give you the link, the email link to do that. And also to provide you with any information that is publicly available on ACPAC trained therapists. If you're a therapist out there and you want to become one, I don't think there's any aversion to that, is there, Julie?
I don't think so at all. No, it's great. Yes,
Yeah.
reach out. I mean, I would love to talk to people if they're
Yeah,
interested, for
yeah,
sure.
perfect. We have been so blessed by you and having you in the studio with us to share this great work. Julie, congratulations again from all of us out in the ACE community, but at the arthritis community at large, and certainly from the pediatric rheumatology families out there. We're just so lucky to have you in our corner. So thanks so much for taking the time to sit with us, and we look forward to having you back.
That's great. It's my pleasure, Cheryl, and thank you so much for all the work you are doing. And I gave that plug to you earlier, but certainly we have learned so much from you and the organization and everything that you are doing on this advocacy front. Thank you for leading the
Takes
way.
a village.
It
We're
is.
part of the
Yeah,
family. Thank you so much. That's very kind of you. Okay, everyone, I think that's it for this session. We look forward to seeing you at the next hashtag C Arthritis event interview. Bye for now.